Hello, my name is Nick Schultz, and for my Eagle project, I'm presenting to you numerous topics relating to emergency preparedness. This one is called, Who Can You Count On and Who Counts on You? It's about establishing a support network. Often during the initial period of crisis, our safety depends on helping each other. Most of us are very willing to help those who may need assistance, but our actions may be limited by not understanding how best to offer help. Building a personal support network is an old-fashioned concept of neighbors helping neighbors. By establishing a personal support network, we know who we can count on and who counts on us, and we will be ready to help. It is important to evaluate your capabilities, limitations, and needs and surroundings to determine what type of help you will need in an emergency. Ask yourself these questions. Will you be able to shut off the necessary utilities like gas, water, and electricity? Can you operate a fire extinguisher? Will you be able to carry your emergency supply kit or critical assistive/medical devices? Will you be able to move objects that might block your evacuation path? You should move or secure objects that could block an evacuation route. And are there potential barriers to being able to evacuate? Do you have an alternate exit path? As well as, are you able to hear or see warnings or announcements? Personal support network can consist of friends, roommates, family members, relatives, personal attendants, coworkers, and neighbors who will check in with you in an emergency to ensure you are okay and provide assistance if needed. Do not depend on any one person. You should identify a minimum of 3 people at each location where you regularly spend your time, like your job, home, school, volunteer site, and etc. For meeting with your network members, invite members of your network to a planning get-together. Making it a social event by adding coffee, tea, and cookies works well. During this session, discuss each other's needs and how you can help one another. Explain how you may need different help in the events of an evacuation, power outage, darkness, or other conditions. Provide written emergency contact information with key phone numbers of relatives and medical professionals. You should also include relevant medical information, such as types of medication, doses, and locations where items can be found. Also note any vital things to check in the event of a fall or other injury. Show the members how to operate and move any assistive devices or specialized medical equipment. Attach laminated labels to equipment with operating instructions. If you have service animals, make sure they are familiar with the members. Give copies of keys to get into your home or office in case of an emergency. Work out a system for contacting one another during a crisis. Signals can be whistles, shouting, knocking, or visual signs. Do not count on telephones as the only means of communication. Develop a system for letting others know when you will be traveling. Select a way to communicate to let the members of the network know that you are safe. Finally, make a commitment to get together periodically to review the plan. Some carry with you supplies to keep with you at all times includes emergency health information card, instructions on personal assistance needs and how best to provide them, a copy of emergency documents, essential medications or copies of prescriptions, at least a week's supply, a flashlight on keyring, a signaling device like a whistle, beeper, or bell, a small battery-operated radio with extra batteries, and a packing container. Suggestions include a fanny pack, backpack, or drawstring bag that can be hung from a wheelchair, scooter, or other assistive device. Here are some specialized supplies to add to emergency kits. Check with your medical provider to determine a sufficient quantity of specialized supplies to last for up to 2 weeks. This includes medication syringes, colostomy supplies, respiratory aids, catheters, padding, distilled water, and etc. If you have chemical sensitivities or respiratory or cardiac condition, store towels, masks, industrial respirators, or other supplies you can use to filter your air supply. Emergency shelters or first aid stations might not be able to meet your supply needs. In an emergency, supplies will be limited. You should store supplies in areas you anticipate will be easy to reach after disaster. If you are unable to afford extras, consider contacting disability-specific organizations, such as the Multiple Sclerosis Society, Arthritis Foundation, United Cerebral Palsy Association, and etc. They may be able to assist you in gathering low-cost or no-cost emergency supplies and medications. Additional items to consider are extra eyeglasses or hearing aids if you have them or have coverage for them, battery charges and extra batteries for hearing aids, motorized wheelchairs, or other battery-operated medical or assistive technology devices, copies of medical prescriptions, doctor's orders, and the style and serial numbers of the support devices you use, medical alert tags or bracelets or written descriptions of your disability and support needs in case you are unable to describe the situation in an emergency. Supplies for your service animal. And medical insurance cards, Medicare/Medicaid cards, physician contact information, and a list of your allergies and health history. Some more items to consider include a list of the local nonprofit or community-based organizations that know you or assist people with access and functional needs similar to yours. A list of personal contacts, family, and friends that you may need to contact in an emergency. A laminated personal communication board if you might need assistance with being understood. If possible, extra medicine, oxygen, insulin, catheters, or other medical supplies you use regularly. If you use a motorized wheelchair, have a lightweight manual chair available for emergencies. Know the size and weight of your wheelchair, in addition to whether or not it is collapsible in case it has to be transported. Even if you do not use a computer yourself, consider putting important information onto a thumb drive for easy transport in an evacuation. All of the information in this presentation was provided by FEMA using official material. The contents of this presentation and more information can be found at www.fema.gov. My name is Nick Schultz, and thank you for watching.